2024 SNMMI annual meeting in Toronto brings together leading experts, researchers, and technologists from around the globe, all united by a common goal: to advance our understanding of nuclear medicine and improve patient outcomes. Attendees are exploring groundbreaking research, cutting-edge technologies, and share invaluable insights that will shape the next generation of diagnostic and therapeutic practices. We take a closer look at some of the highlights of the meeting. You're watching SNMMI TV. You can catch us around the Convention Center in Toronto, select hotels, on the SNMMI website, social media, and YouTube. With new content available each day, make sure to keep watching. Welcome to the Metro Toronto Convention Center and our final episode of SNMMI TV 2024. We have an exciting program coming up for you today. We hear about the nuclear cardiology highlights of the meeting and take a look at organizations at the forefront of nuclear medicine. We also find out who the winner of this year's Image of the Year is. Finally, we have some advice for young professionals just starting out in the field. As you can see, we have an exciting program coming up, so stay tuned for our first interview. You're watching SNMMI TV. Research scientist James Thackeray is here talking about some of the cardiology highlights here at the meeting. Thank you for joining me.
Thank you for having me.
So let's talk about some of the groundbreaking research right now in cardiology.
So I think some of the major highlights of this year's meeting is a continuation of the trend which brings imaging targets closer to therapeutic targets. And the exciting area is being able to visualize precisely the markers that we're trying to treat so that you can get a more integrated theranostic look at how disease improves in response to new therapies and how we can visualize and monitor that over time.
I know that your specialty, of course, is the research, but how does what you're finding and using in the lab translate to, from bench to bedside?
So it's one of the real benefits of nuclear medicine is the compounds that we use preclinically are inherently translatable to clinical application. These are all the same compounds that can be used clinically. Our work immediately translates or in parallel translates to clinical work. And a lot of the findings that we have in looking at inflammation or fibroblast activation after cardiac injury get in parallel viewed in small animal models and large animal models and in patients. And there's a great deal of opportunity looking at theranostics and new treatments that build off of these same molecular imaging markers.
And this really has the potential to transform cardiology care. Let's face it, heart disease is one of the #1 killers.
Yeah, and I think it also moves us towards the ability to treat individual patients in the appropriate way for those individuals. That identifying patients with different molecular signatures to their disease, you can tailor the appropriate therapy a little bit more effectively.
And how will that transform cardiac care?
I think it builds a new bridge towards how nuclear medicine is integrated into patient care. That if we can move towards handling patients and not giving them all the same drug, that they're getting a drug that is perhaps very expensive or very focused and targeted, then we're at least treating the correct patient the correct way without unnecessarily treating with a false target application.
Moving toward more personalized medicine in your years of research, that must be very exciting for you.
It very much is. I'm very much looking forward to what this means for the future.
Okay. All right. Thank you for joining us.
Thank you.
Kettering Health established Ohio's first PET cyclotron center in 1990, 10 years prior to FDA approval and before most academic centers. Kettering Health now aims to enter the next phase of innovation and deliver advanced theranostic-based approaches to therapies in the community hospital setting.
Kettering Health has a long history of being very innovative in the field of medical imaging and technology in general. Kettering Health was the first institution in the city to have CT scanning. They were the first to have MRI, and they were the first to bring in PET scanning.
So you can imagine that this was a very unique situation for a community hospital to be sitting with this revolutionary technology some 30 years before it became really clinically implemented.
So with nuclear medicine, the big breakthrough has been molecular imaging that has taken off, but side by side, and as a result of molecular imaging, theranostics has taken off, because now the therapy is completely guided by the diagnostic imaging we do from the molecular imaging side. So with that foundation being laid, we provide radionuclide-based therapies, which we've been doing in nuclear medicine for well over half a century. But now it's become much more sophisticated. We want to do research, which would be an academic style research, but the research isn't for the purpose of research alone. The research will be something that we feel is going to be directly beneficial to our patients and community.
Now, it's time you, the attendees, get a say as well. We wanted to know what advice you would offer someone who's just starting out in the nuclear medicine field.
What I have to say to the new dreamers of starting something in nuclear medicine industry is just throwing around, going to congresses like this.
I haven't been in this conference in 10 years, and coming back, I feel like I'm meeting the same people that I used to work with 10 years ago. So build those strong relationships and it will last your lifetime.
Stay curious and say yes when opportunities come your way, and you will find that you will carve your path as long as you stay curious, stay involved, and really explore your passions.
Meet other technologists who are in the field that you can learn and grow from. So definitely volunteering with other societies is a great way to get your foot in the door with experience, and also learn from other techs that have been there.
Just go and learn everything. Push through, conquer, and just work with your doctors, with your pharmacy personnel, also your physicists. So it's a very broadened aspect, and you can learn a lot from every part of nuclear medicine.
Oh, this is a good question.
Highlight Symposium speaker Twyla Bartel is with me now. Thank you for joining me.
You're welcome. Thank you for inviting me.
Can you give us a little tidbit of some of the significant research you're covering in your talk?
Since I'm doing general clinical specialties, it's a wide range, but there is one that impressed me right off the bat. It's related to pediatric patients. They're thyroid cancer patients, and one institution, sometimes we give them what's called recombinant TSH before we treat them, so they won't have to have their thyroid symptoms, really bad before their treatment. Usually you give them 2 doses of this, and if you're injecting a pediatric patient twice on 2 different days, that might be a little painful and difficult on them, the parents' work schedule. So they tried doing just 1 injection and have had really good results. So I think that's going to be something we're going to look at in the future for our pediatric patients.
It's always wonderful to enhance patient care, and especially with children, and making them feel better. Can you discuss, in your vast amount of knowledge and research, technologies and techniques that might be really advancing the field of nuclear medicine?
That actually makes me think of another couple of research projects or abstracts that we received that stood out to me. There are a lot of patients that have chronic pain, and they go through all of these procedures, all of these treatments, and it doesn't really resolve. There were a couple of institutions that were looking at using our FDG PET-CT to exactly localize where that pain is, even down to the nerve level. And using that, they've had successful treatment in those patients. So I think that's something that will probably grow in the future. Pain patients where we can't really treat them, you really can't localize it, but now we can. So
And I know you also do a lot of mentoring. What is the key to that?
The key to that is just being down to earth, try to talk to them at the same level and get them involved, ask what they're interested in, and then try to mentor them and encourage them, direct them in the areas that can help them with their career choices, job opportunities, and just what they're interested in. I think it's just being a personal friend to them also.
And I know with the new generation, there's technology issues that are different.
Oh, yes, absolutely. And that reminds me of another research project. There was a couple of them that were talking about ChatGPT. And, I think a lot more people are looking at that or exploring that, using that for their teaching their residents and educational purposes. This particular one was comparing ChatGPT 3.5 and 4, and the results were that 4 was better. So hopefully people will pay attention to that when they're creating their educational programs and using that resource.
Clearly, over the years that you have been in the field, things have changed. As you look ahead, what do you think some of the trends in nuclear medicine might bring us, say, over the next 5 or 10 years?
Well, I think we've already entered that arena right now with theranostics. I think we have a lot more growth in that area, and I still think we have a lot more growth with our PET-CT, different radiopharmaceuticals that are coming up still that need to be approved, and some of them are more specific to the disease process. I think we're going to have a lot of success in those areas.
And that's why really the research is so important.
Yes, it's important to look at that ahead of time.
All right, Twyla Bartell, thank you so much.
Oh, thank you for having me. I appreciate it.
I'm back now with Dr. Richard Carson and some exciting news. You are the recipient 2024 Henry Wagner Image of the Year.
Thank you very much. We're very excited to receive it.
So tell us about that image and what it means.
So we have been fortunate to build a collaboration over the last now 5 years with our team at Yale University, with the team at University of California, Davis that pioneered the total body systems, and with our industry partner, United Imaging Healthcare. And we were able to build a true next generation brain PET system. Now, brain PET systems, the last best machine was developed over 20 years ago, the HRT, High Resolution Research Tomograph. A very good machine, but there hadn't been the impetus to be able to push the technology forward, to be able to truly image extremely small structures within the brain. Now, lately, over the last 10 years, there's been a lot of interest in the society and related societies about developing this technology. But here we were able to put together the experience we had in brain PET imaging with the HRT, the experience at UC Davis with doing high sensitivity imaging, and the experience of United Imaging of actually building a production system. And we were incredibly excited to get funded by the NIH Brain Initiative to be able to support that work, and then be able to develop and deliver the system pretty much on time, which is pretty much unheard of. And now it's very exciting this year. What we've been able to do is use the great array of radiopharmaceuticals that we've been having to study the brain, but doing that at ultra high resolution and ultra high sensitivity.
So talk about how that's going to revolutionize patient care.
So what's incredible there is if we can truly see that branch out beyond the research labs, but actually into the clinical labs, it's going to let us being able to make some of these exquisite measurements. So one area would be in early Alzheimer's disease, where the deposition of the tau proteins in a very small region of the brain, the entorhinal cortex, to be able to measure that extremely well, to be able to say, yes, this is a patient that would be appropriate for some of these new therapies that are coming out. Or even better, there's a lot of hypotheses about an even smaller region in the brain, the locus ceruleus. Can we start imaging that and reliably quantifying and say, yes, this subject is showing deposition of these proteins. Same in Parkinson's disease, looking in the substantia nigra and being able to measure these very, very small regions. But one other little subtlety that may come out of this, our machine is sensitive because like the Total Body Explorer, it's long, it's 50 centimeters, goes down to the shoulders, which means not only can we image the brain, we can image the head and neck. And I'm excited about our early data showing the improvement in cancer imaging in head and neck just by having ultra high resolution. It will let us see and quantify tumors, lymph node infiltration at a much higher resolution. And so far, I'm expecting that our oncologists are going to get very excited as they see the improvement in those images and the ability to affect patient selection and treatment.
So you're hinting at the future. What is your ultimate goal?
Right, so we have lots of great questions about what we can do in imaging the brain relevant to application. So another aspect of the high sensitivity means we can inject a lot less radiation. And that opens up the ability to begin to do scanning in adolescents. So we have collaborators doing an autistic spectrum disorder, in schizophrenia, diseases believed to be happening in the teenage years. And can we begin to do those scans with ultra low radiation dose? Say the amount of radiation you get by, flying to Disney World and back with your kids. And that would be the place where now our tools will be broadening much, much more to be very, very relevant in diseases where it's not clinically needed at that point, but it could drive the research and then the tools to be able to identify appropriate treatments. And that is incredibly exciting.
It is fascinating. I see why you are the award recipient. Congratulations again.
Thank you so much.
It's
a great honor.
That's it for our final episode of SNMMI TV 2024, and we hope you enjoyed our shows. Don't forget, you can still watch all of our episodes online, and make sure to subscribe and follow SNMMI TV on social media. Thank you so much for joining us, and we will see you next year in New Orleans.